Recent changes to Social Security, impacts on beneficiaries. The Social Security Administration, SSA, has recently announced two significant changes that will have far-reaching implications for many individuals, both positively and negatively. These changes reflect the agency's ongoing efforts to address administrative challenges while balancing the needs of beneficiaries. The first change involves the reinstatement of two critical programs that were previously cancelled, which had caused significant disruptions for residents of a specific state. The second change, however, introduces a stricter policy regarding the recovery of overpayments, which could create financial hardships for many beneficiaries. This article will explore these changes in detail, examining their implications and offering guidance for those affected. The reinstatement of two vital programs. One of the most positive developments in recent Social Security news is the reinstatement of two essential programs that had been abruptly cancelled. These programs, the Enumeration at Birth (EAB) initiative and the Electronic Death Registration (EDR) system, were previously eliminated in a specific state, leading to widespread concern among residents, experts, and advocacy groups. The cancellation of these programs had created unnecessary complications for both citizens and the Social Security Administration, but their reinstatement is expected to alleviate many of these issues. Enumeration at Birth (EAB). The Enumeration at Birth program was designed to streamline the process of assigning Social Security numbers, SSNs, to newborns. Under this program, hospitals in the state automatically submitted the necessary information to the SSA, allowing newborns to receive their SSNs shortly after birth. This process was not only convenient for parents but also ensured that families could quickly access essential benefits and services, such as healthcare coverage, tax credits, and other government programs. However, when the EAB program was cancelled, parents were required to apply for their child's SSN manually. This involved additional paperwork, visits to Social Security offices, and potential delays in receiving the number. For many families, this added burden was particularly challenging, especially for those living in rural areas or facing financial constraints. The manual application process also increased the workload for SSA employees, who had to process a higher volume of individual requests. The reinstatement of the EAB program is a welcome relief for parents and SSA staff alike. By automating the process once again, the SSA will reduce administrative burdens, minimize delays, and ensure that families can access the benefits they need without unnecessary obstacles. This decision underscores the importance of maintaining efficient systems that serve the public effectively. Electronic Death Registration (EDR). The Electronic Death Registration System was another critical program that had been discontinued. This system allowed state agencies to notify the SSA immediately when a death occurred, ensuring that benefit payments were promptly stopped. This timely notification was crucial for preventing overpayments, which could lead to complex and stressful recovery processes for surviving family members. When the EDR program was cancelled, the SSA no longer received automatic notifications of deaths. As a result, benefit payments sometimes continued to be issued to deceased individuals, creating situations where families were required to repay these amounts. This not only caused financial strain but also added emotional stress during an already difficult time. Additionally, the lack of immediate notifications increased the administrative burden on the SSA, as employees had to manually track and rectify overpayments. The reinstatement of the EDR program will address these issues by restoring the flow of real-time information between state agencies and the SSA. This will help prevent overpayments, reduce the need for recovery actions, and ease the workload for SSA staff. For families, this means fewer bureaucratic hurdles and a more streamlined process during times of loss. Acknowledgement of past mistakes. The decision to cancel these programs was made under the leadership of an interim commissioner, who has since acknowledged that the move placed an undue burden on residents. In response to widespread criticism and concerns raised by citizens, advocacy groups, and experts, the current administration has taken steps to rectify the situation. The reinstatement of the EAB and EDR programs demonstrates a commitment to correcting past mistakes and ensuring that the SSA operates in a manner that prioritizes the needs of beneficiaries. This reversal is particularly significant because it highlights the importance of maintaining programs that enhance efficiency and accessibility. It also serves as a reminder of the potential consequences when such programs are discontinued without adequate consideration of their impact. The reinstatement of these initiatives is expected to prevent similar issues in other states, which might have followed suit if the cancellation had remained in place. The stricter overpayment recovery policy, while the reinstatement of the EAB and EDR programs is undoubtedly positive news, the SSA has also announced a more controversial change that could have significant negative consequences for many beneficiaries. The agency has decided to reinstate a policy that allows for the recovery of overpayments at a rate of 100% of monthly benefits. This means that individuals who owe money to the SSA will have their entire monthly benefit withheld until the debt is fully repaid. Background on overpayment recovery. Overpayments occur when the SSA disburses more money to a beneficiary than they are entitled to receive. This can happen for various reasons, such as errors in reporting income, changes in eligibility status, or delays in updating records. When overpayments are identified, the SSA typically seeks to recover the excess funds by deducting a portion of the beneficiary's monthly payments. During the Obama administration, the SSA implemented policies that allowed for more flexible repayment arrangements. Beneficiaries could negotiate payment plans that deducted only a small percentage of their monthly benefits, enabling them to repay their debts over time while still receiving a portion of their payments. This approach was designed to minimize financial hardship and ensure that individuals could meet their basic needs while addressing their obligations to the SSA. The new policy, 100% recovery rate. Under the new policy, however, this flexibility has been eliminated. The SSA will now withhold 100% of a beneficiary's monthly payment until the overpayment is fully recovered. This change is expected to take effect on March 27, and affected individuals will receive notification letters informing them of the new deduction rate. For many beneficiaries, this policy shift could have devastating consequences. Those who rely entirely on their Social Security payments to cover essential expenses such as housing, food, and healthcare may find themselves without any income until their debt is repaid. This could lead to severe financial instability, particularly for vulnerable populations such as older adults, individuals with disabilities, and low-income families. Exceptions and appeals. It is important to note that not all beneficiaries will be subject to the 100% recovery rate. Individuals who receive Supplemental Security Income, SSI, will continue to have their overpayments recovered at a rate of 10% of their monthly benefit. However, for all other Social Security beneficiaries, the impact of this policy will be much more severe. The SSA has stated that individuals who cannot afford to have their entire benefit withheld can contact the agency to request a reduction in the deduction rate. To do so, they must call the SSA's official phone number or visit a local office. However, this process may prove challenging due to staffing shortages within the agency. Reports indicate that approximately 7,000 employees will be leaving the SSA, reducing the total workforce from 57,000 to 50,000. This reduction in staff is likely to result in longer wait times and delays in processing requests for adjustments. Preparing for the change. For beneficiaries who are currently repaying overpayments under more flexible arrangements, it is crucial to prepare for this change. Those who receive notification letters in late March should act promptly to contact the SSA and request a reduction in the deduction rate if necessary. While the process may be cumbersome, taking proactive steps can help mitigate the financial impact of the new policy. Advocacy groups and experts have expressed concern that the 100% recovery rate could push many beneficiaries into financial distress. There is also the potential for legal challenges and public outcry, as affected individuals and organizations voice their opposition to the policy. In the coming weeks and months, it will be important to monitor how the SSA implements this change and whether any adjustments are made in response to feedback from stakeholders. Balancing positive and negative impacts. The recent announcements from the SSA highlight the complex balancing act that the agency must perform as it seeks to address administrative challenges while serving the needs of millions of beneficiaries. On the one hand, the reinstatement of the EAB and EDR programs is a positive step that will improve efficiency and reduce burdens for both citizens and SSA staff. On the other hand, the stricter overpayment recovery policy raises significant concerns about its potential to create financial hardship for vulnerable populations. As the SSA moves forward with these changes, it will be essential for the agency to maintain open lines of communication with beneficiaries and stakeholders. Providing clear information about the new policies, offering support to those affected, and addressing concerns in a timely manner will be critical to ensuring that the transition is as smooth as possible. The recent changes to Social Security policies underscore the importance of thoughtful decision-making and the need to consider the broader implications of administrative actions. While the reinstatement of the EAB and EDR programs is a welcome development, the stricter overpayment recovery policy serves as a reminder of the challenges that many beneficiaries face in navigating the complexities of the Social Security system. For individuals who may be affected by these changes, staying informed and taking proactive steps will be key to managing their financial well-being. As the SSA continues to implement these policies, it will be important to monitor their impact and advocate for solutions that prioritize the needs of beneficiaries. By working together, stakeholders can help ensure that the Social Security system remains a reliable source of support for all who depend on it.